So welcome to the Smart Curriculum Academy Leadership Webinar Series. This is number 4 in our series. We welcome this afternoon Debbie Dowsett, someone who I've worked with for a number of years within St Mary's Church of England High School in Cheshunt. I'm going to leave her to explain a little more of why she's here, but the subject of this we're looking at this afternoon, many will have done their level 1 safeguarding training that keeps children safe at the beginning of the year. But I just thought it was appropriate to call on someone who is an expert practitioner in the field just to talk about some of the issues, particularly at this very unusual time across the country with the pandemic and what's going on in schools, what has gone on in schools, or at least in the environs of the school over the last term, and now what we're facing now. Welcome, Debbie. Thank you for joining us this afternoon. I'll leave you to introduce yourself.
Hi, thank you, Chris. Welcome everyone to the Keeping Children Safe webinar. Before I begin talking about principles and a model that I've adapted called the Golden Circle for good practice in schools, I wanted to give a little bit of context as to why I'm sat here with you all today. My background is in social work. I qualified in 1999 and I've had various senior roles in children's services and the NHS. Several years ago, I came away from field social work and decided to use my knowledge, expertise, transferable skill set within the education sector with a vision to raise, I suppose, safeguarding standards and practices within schools. I think that my social work experience gives me a different edge, perspective, understanding and insight into safeguarding issues and practices within schools. As Chris has said, in my current role, I am a safeguarding officer and lead DSL for a large secondary school in Hertfordshire. I was employed as my school had already developed a strong pastoral system and a vision of what safeguarding should look like. However, as many of you may have experienced, with the constraints on senior teaching staff who assume quite often the DSL and DSP roles, and with the emerging complex needs of our students and families, it was decided that someone with a social work background, non-teaching staff effectively, therefore allowing them to be off timetable full-time, and someone who had an in-depth knowledge of working with families and young people would be able to bring the school's vision alive and embed safeguarding holistically into the culture of the school. I've been able to bring clarity through excellent communication and promote consistent practice within the school and with outside agencies, as I've been able to see the whole picture of the need across the school, which is so important, and the wider community. I must say I'm very proud of the robust safeguarding practices that we as a safeguarding team at my school have embedded. Sorry, I'm just trying to go down. Sorry, I'm just trying to get it to go down. There we are. Okay, I'd like to briefly touch on principles of good practice and the Golden Circle model that I've adapted and used for effective safeguarding practice in my school. This model is simple, it's effective, and offers a practice that is consistent, robust, and safe if fully embraced. So starting with the principles. For practice to be embedded effectively into the culture of any school, basic principles of good practice need to be shared with all staff. These principles should underpin the practice of every staff member. As you can see, I've highlighted some key principles. For me, and every professional role I've undertaken, the child's welfare and safety should remain paramount at all times. Within the school setting, the language that every member of staff should know is safeguarding is everyone's responsibility, and I can't place emphasis on this enough. I refer to this as a whole school approach. Consistent, effective practice. No member of staff works in isolation, and the decision-making process is transparent and clear in line with safeguarding policies and procedures. The school or education setting should have a shared vision for the outcomes of children and young people. Schools should prioritise maintaining the core purpose, which is effectively delivering education, but paralleled with ensuring the welfare, well-being and safety of all students. The well-being of staff is too very important and should always be considered and prioritised. Accurate recording of information, again, is essential, and all staff should know the procedures involved for reporting concerns. And finally, establishing positive partnerships with both parent, carers and professionals is invaluable, thus ensuring the needs of the young person and their family are met and the young person can access the right provision and support. I want to now go on to the golden circle, as I say, which I've adapted, looking at what we do, how we do it and why we do it. What we do. At our school, we support, safeguard children, young people and staff. We deliver an excellent range of learning opportunities and education in a safe environment. We empower and enable our students and young people to make safe lifestyle choices and involve them in the decision-making process if they're Gillick and Fraser competent, but at no point forgetting it is their life that we are dealing with. A multidisciplinary approach with professionals and parent carers. Best practice and evidence always places huge emphasis on this, and it's integral to safeguarding. How we do this. We embed a whole school approach. As I've touched on, safeguarding is everyone's responsibility. Staff to have a shared vision for young people, their well-being and educational outcomes. Training is integral and a must, and all staff to have safeguarding training and to fully understand the safeguarding policies and procedures within schools. All staff should be aware of how to report concerns and know the school's DSL and DSP safeguarding teams. Examples of how this can be ensured is via posters, leaflets, school website, staff bulletins, briefings, inductions. It's imperative that every member of staff that works in your school, from teacher, SLT through to cleaning staff, know who those people are that will respond to those needs. Effective reporting and monitoring tools such as CPOMs. I brought that into our school about 3 years ago. I'm sure some of you may use it or something similar. CPOM should work alongside your existing safeguarding processes. It's a robust tool enabling staff to work collectively in meeting the needs of students. Again, as I've touched on, establishing working partnerships with parent carers and professionals. Good multi-agency working in the local and wider communities. Something that is often a barrier, which some schools will identify with and some won't, is adequate and effective information sharing, both within school and with agencies. Staff really do need to fully understand how to and what information can be shared, adhering at all times to GDPR and other related policies. Supervision is something we brought in to our school about 18 months ago with the emerging needs of our students and ultimately the pressures that puts on pastoral teams. We wanted to bring supervision in, enabling staff to have time, space to discuss case management, but crucially along with reflecting on their practice. And also how we do this is the curriculum. PHSE is a platform that ensures our students are given the knowledge to empower them to keep themselves safe by making right choices in the school and the community. This is delivered through lessons, online learning, external providers, and peer group activities. But now I move on to why we do. This is the core of good practice, understanding why we do what we do. For me, there are several things as highlighted in this presentation, starting with every child matters. This isn't fundamental to my professional approach and practice. It's ultimately why I became a social worker. I'm very passionate about ensuring the safety, welfare and well-being of children and young people. My transferable skill set enables me to share good practice and embed effective safeguarding practices into the school. And ultimately, effective practice should lead to ensuring that all our young people get the same opportunities for a positive and successful life despite the individual stories and life experiences. Together, we create a positive change for children and young people. Thank you for listening, and I'll pass back over to Chris. Thank you.
Debbie, thanks for that. I mean, that's the formal presentation part. So now we come down to sort of the nuts and bolts. I was really interested in the what, how, and why, because obviously a lot of what we do in education, we must, therefore it's done. But you're coming down to an understanding of why you do what you do, and then what do we do. In terms of you taking over as a designated safeguarding lead within your current post,
yeah,
what for you were the priorities? Because you came from a very different world, didn't you? You came from social work and the National Health Service, and some of the practices would have been quite different. For you, what were the priorities? I don't mean that you don't have to share specifically for the school, but in terms of what you found within education, what was the main process you went through?
Thanks, Chris. I think, as I touched on, many people that are DSLs and DSPs are their educationalists. They are teachers, they're senior leadership team members. And I think, certainly for my role being acquired at the school that I'm in is because ultimately recognising that there was a great need emerging within our young people and their families, that teaching staff didn't have that time and opportunity to possibly dedicate and meet the needs of those young people as holistically as the vision is, which is why I said, it's about keeping that vision alive and bringing it together. I refer to it as almost bridging the gap between that shared vision, which is there, but the practice element to it, which can sometimes have those barriers because of the constraints on teaching staff. So in my area where our school is based, I am locally the only sort of full-time person that assumes this role. And I think it's fundamental to meeting the needs of our young people, which we do very effectively. And I think by doing what we do, we allow the staff and the teachers to get on with their roles and running the school and the operations that are involved. So we take that and we reduce that stress, and ultimately we're able to safeguard effectively.
I mean, that's great in a largest secondary school, which is where you are. That doesn't work in every type of school, does it? I mean,
no.
Obviously small primary schools are not going to have a full-time worker like yourself. Are there any sort of markers of practice that you see that you share with your people? Because obviously, you've made some key, or you've put in place some key actions that make this work with the staff that you're currently with. And I know you work with local schools beyond the gates, don't you? So you are working with partner organisations, and you've made that clear in your presentation. So in terms of behaviours that you find, what do you see happening in other schools?
Yes, I mean, we are, as I say, I'm very fortunate in the fact that we have a huge pastoral support system, from family support workers to student managers that are off timetable, where every year group has one, to our Place to Be counselling service and St Giles's Trust. So holistically as a school, we have layers of pastoral support that's really embedded and that all our students are accessible to. But obviously, I'm recognising that isn't applicable in every school environment. I think for me, one of the biggest areas in safeguarding is ensuring that there's a consistent practice, so that individuals with this responsibility, and it is a huge responsibility, don't work in isolation, that there is a shared practice amongst teachers with this responsibility. But collectively as a school, as I've touched on, every member of staff should know that yes, there may not be that off-timetable student manager or that head of year available at that time, but they need to know the processes involved from the moment they arrive in that school as to how to report. And as I say, I touch on very much coming from a social work background. I've lived my career making sure that practice is to the best of it can be, because of the consequences if we don't. And working in isolation is a barrier to safeguarding. And I sometimes think that, because they assume the role, that sometimes they feel that is on them to make those decisions, but it's a whole school approach. There's shared accountability. And I think it's just making sure that those barriers aren't in place, because ultimately the safeguarding practice will be impacted upon, and therefore the needs of that child may not be fully met.
Yeah. And just picking up on something else that you referred to, because you talked in your presentation about the aspect of supervision. Now we understand that kind of the offloading, the need to share. You talked about sharing practice. How has that impacted the work? In terms of within the health service, that it's common practice to be
yes, it is, yeah.
to have a supervisor, not in the employment sense, but in the that well-being sense of being able to share what's going on, and the understanding that there's no secrets within this process. How's that benefited the staff where you're working? What does that look like?
Well, I think supervision, I mean, in my profession, I've had case management supervision. I've also given supervision in senior roles, but also you have clinical supervision, peer supervision, ultimately forums where practice is evaluated in a positive for the practitioner. So, you know, it's around looking at that case management, looking at possible things that if we haven't been able to get something through to children's services, or we're finding there's a block, we're not meeting a threshold, but there's a risk. You know, it's understanding what other resources are available, how we can take that and navigate that through to hopefully get it to the service we wish. So there's that case management style to it, but there's also that reflective practice. If you're having the same conversation with the same parent carer because that child is not coming into school, you know, it's very difficult because, you know, there's a reliance on that member of staff that pastorally we need to be trying to get that child in, which obviously we can do what we can do, but then there's limitations. So it's just just an example of, you know, frustrations that practitioners feel, but obviously they want the best for that young person. They want them to be accessing the education, but there's barriers to that happening. So it's that reflection of how things can move forward. So for us, It's around looking at practice, evaluating it, and finding ways of moving forward effectively, depending on the situation that's being encountered.
Yeah. And some of the you've reeled off. I mean, it's obviously part of your week and it's part of your regular practice. You've reeled off resources that you use within your setting currently. Yeah. How much do you find yourself as a gatekeeper or as an instigator of those kind of resources? Do you? Because you've talked about education is the core purpose, and the reason for this is all about getting children back into the education and learning experience. How much do you find yourself acting as a gatekeeper or a resource finder? What does that feel like?
Well, I mean, ultimately, we have, as I say, within our school, we're very fortunate in the fact that we have a lot of in-house resources. But we obviously still have to have that whole school approach where we will decide as a school what next steps are needed. Ultimately, my role in overseeing the day-to-day of the safeguard is ensuring that that we access the right resource, because we're looking at a needs-led effective delivery, which is meeting the needs of our young people. So that is what leads us in the service that we access. So, you know, I will work with the safeguarding team and respond to those needs. And yes, there are times when, as a social worker, or my background is, you know, I know the systems, I know thresholds, I know what we are going to be, you know, potentially met with in terms of barriers for accessing those provisions. So it's understanding how the language of putting in referrals is so important. If you speak to most children's services, you know, when you're putting that referral in, the language that you use, indicating the risks, indicating those factors that can reduce harm and can increase it, are really key to getting those services pushed through to meet our young people's needs. So it's just collectively all that together works well. And it works well because I've got that experience having been a social worker. I know what's expected from the other side, so that I can try and almost have that dialogue and navigate where we need to get to meet our young people's needs.
And the reason you're sitting here, Debbie, is because you bring that level of expertise to this environment within a particular institution and in an area where you are now. And I know people look to you because you bring that level of expertise. If you were going to comment on the wider you know, safeguarding across the education system, what would you say, what do you feel, given your passion about this, are the needs of the system? You know, your expertise as you bring now, how would, if every school had a Debbie Dowsett, we might be in a very different position, but we don't, because you can't clone yourself at the moment. So what is it that you bring to the kind of environment that you're in that is different, and how could people follow that example? Or what is it that you bring that is different from the standard teacher-led DSL training, and you know, I know. So we go through the statutory stuff, and you get to your level 3, and you're there. But you bring and you talk about it in such a different way that the driving passion, the core purpose of children being able to learn in a safe environment. Sadly, schools are for many the safe environment in their lives. But what is it that would make that difference, Debbie?
I think ultimately it's, you know, as I sort of touched on earlier, you know, my role has enabled teaching staff to still maintain very positive relationships with their students and young people, yet coupled with the fact that on occasions we have to hold parents to account and have those very difficult conversations. So, you know, I've had that experience with my social work background of working with many challenging parents and in very, very difficult situations. So it's understanding the boundaries, professional boundaries, and the language used to really express that concern with the child remaining at the centre, but still realising that there are issues that we as a school need to work with to address. And I think that is one of the defining things that I can bring, is with my experience. And I think that's one of the most important things that I have tried with the heads of years, with the pastoral teams, to understand what that language and dialogue can look like, where they have that confidence to have those meetings, where that still child is at the centre, delivering that education is core, but there are still concerns and issues that we have a responsibility to address, but do it in a way where hopefully it's effective. And like I touched on in why we do this, it's about creating that change for that young person. Absolutely,
absolutely. We've got a couple of questions that have come in from people that are listening. So if I'm just going to pose them to you, if that's all right, Debbie. Someone's asked, if people are DSLs with little experience, what would you recommend them to do by way of CPD? So they don't have your background, they're coming at it. We pick up all of your passion, and you know it's an area that drives you. But someone that's coming at it with passion because they're in the education profession, and that's what we're all guilty of. You know, doing what we do for all the right reasons and that moral purpose. But if you were going to give some advice on what training, and I'm going to use the word training rather than CPD, where would you suggest they go? What could they draw from that would get them to where?
I mean, it's a challenging one, because I do feel, because you know you come into a teaching profession because you are passionate about young people. That's why you're in a school, but you're also passionate about a subject that you're delivering. You then embrace pastoral support, and then you'll get put on a 2-day DSL, DSP course, and then suddenly you're responsible for safeguarding. So that leap is huge. And I think for some people, like the participant has said, they're inexperienced. I think that all schools should have a robust system that if they are becoming a DSL or DSP, they're not going to be the first person in that school to undertake that role. So I think the shadowing process is integral. I don't think that any DSP or DSL should just be saying, right, you've had your 2-day course, there's your induction, there's your pack, you know, off you go. Because ultimately they're put in a situation where responsibility and accountability is placed upon them, and they need to feel confident in the decisions and anything and the processes they're accessing. So I think starting point, you know, a shadowing induction, I think within the school, when they assume that role, should be in place. I think from a training point of view, there's lots of online things that they can do. I mean, there's I think it's coming to grips with just the umbrella of safeguarding is so broad, but I think it's just keeping awareness of those things that are continuously changing, which is the keeping children safe. That procedurally sets out very clearly how a school should respond. So it's knowing those policies. And if you can get yourself on any online training, I think it's becoming aware of local policies, your local borough procedures. So in Hertfordshire, there are very clear guidelines. So it's taking that time to access that information. And if you know that you're going on the DSL course, I would always suggest that rather than do the DSL course, I know everyone's busy and you know, life becomes busy because of everything, but you actually take time before that course, because the moment that certificate is in your hand and you walk back into your school, you assume the title. So it's about trying to embed some of that knowledge to give you the confidence. So when you have done that course and you go to practice, it's embedded in a little bit of your knowledge and understanding, which will then ultimately impact on decisions, processes, and ensuring the needs of their students are met.
Yeah. And I'm just going to, before we go into the next question, can I just sort of get you to expand a little bit? So I've got my DSL certificate. I'm trained. I've got my badge, and I walk into school, and all of a sudden this load appears on my shoulders. Now I know that you don't live like that. So can you tell us a bit, because what you've just talked about is shadowing people that are already in that role, and you've already alluded to some things that are in place that are partly at your instigation. So just tell us the kind of environment that you've created. So the people you've got doing different things, what's the channel, the lines of communication that you referred to earlier. So who have you got around you that support what you do?
So in my team, we have currently 9 DSLs. I'm training up 3 more this term. So we will have in total 12 amongst the staffing team. Each year group has their own DSP attached. And fundamentally, we use as I touched on earlier, in terms of effective reporting and monitoring, which is obviously essential to ensure appropriate practices, we use CPOMs. So I brought that in about 3 years ago. It's a really effective tool that those people that are in those positions have full access to. And through that, we communicate. Even if I'm in a meeting, I'll get alerts through CPOM. So whatever environment I'm in, I can oversee what is going on throughout the school day. Obviously, if there are those emergency situations whereby actually it needs to be dealt with there and then, we have a system where as I say, the majority of the DSPs in our team are non-staffing. So they're available in school. So if it is that something gets brought up, I'm able to delegate down to someone in the school that will be able to respond to that under guidance from myself, but also collectively as a team, we work very well together.
And it should be said that the school we're talking about is a sizable secondary school. It's 210, 240 in a year group, with a large sixth form and a staff of 95 to 100 teachers. So it's not a small organisation, but that you've spent some time in training these people so that you don't carry all of the load, and there is that line of communication between the people. So it's not that everybody's involved, but there is clear designation of who to go and talk to and who to share with.
Absolutely, and it's a shared responsibility, which brings me back down to what I said earlier about working in isolation. I sometimes think when you get this role, depending on the support that you can access within your school environment, that you feel that this is something that you as an individual makes. It's not, it's a collective decision. It's a whole school approach. I'm very fortunate in the fact I have a great senior leadership team that I work very closely with, and that decisions are made. And whenever a decision is made, I don't say I say we. It's the language we use. It's a whole school approach. So even though we may have discussions and there will be a decision made, it is that whole school approach. And I think that's so important, because whatever environment you're in, whether you've got 3 DSPs or whether you've got 12, it isn't a decision that is made individually. It's that collective shared decision and a whole school approach to the need.
And I think I would, just listening to you, the one thing that struck me earlier was you haven't referred at all to the sense of crossing the line. There is no educators and non-educators. There's no teacher and other staff. It is a single staff body who are charged with the collective responsibility of making things safe and for the best well-being of the children. And that's the one thing I value in working alongside you and the team, that is a core status of everybody. It's not about them and us. There's no crossing the line, is there?
No, and I think that's why I touched on, the biggest principle for me, around the child's welfare remains paramount. Every child matters, but also everyone's responsibility is safeguarding the moment you enter that school. So I think that is a key message that every school should be delivering to their staff, from whether they're a cleaner through to a teacher, through to a chef, through to SLT. It is a shared responsibility. Everyone has a duty of care, and everyone has a duty to ensure that those needs of those young people are met in whatever dynamic you come from within that school setting.
Yeah, and my experience of schools across the country is that it makes no difference whether it's a challenging area or a seemingly easy area. The issues are still there wherever you go. So it's really important that this is engaged with everywhere.
Absolutely, I couldn't agree more.
Someone has said, so can you just, you've talked about CPOMS, which is the online system that you use to record. Someone apologising for little experience, that's the reason for doing this, is to get out the kind of things that go on. Could you talk a bit about how supervision actually works in practice for the staff? What does that look like? You know, so in any say, how does supervision work with teachers and
so supervision for the safeguarding team is obviously, we've had a very tenuous last 6 months, unprecedented times for education and for the world due to, sadly, the pandemic. So things are looking to start up again effectively, but prior to that we were having supervision and it was working out as an hour and a half termly, but paralleled with that, that's when we would get an external person in. It's done externally. But what we also do is we have regular DSP meetings every 2 weeks. So every 2 weeks, everyone would sit around the table.
When you say everyone, do you mean your team rather than the whole staff?
Yeah. No, our team. Our team will meet twice monthly, so every 2 weeks, for about an hour and a half. I lead on those meetings. They're there for any updates from policies that I want to share, any information I get from local resources. But also it's almost a bit of an informal, not peer supervision as such, but if there are things that people are frustrated by, that they can't get a case moving forward, it gives us, for all of us together, to sit around the table and share our ideas of how we as a school, as I say, this isn't one person, it's a school approach, how we as a school can collectively come up and share ideas of how we can support each other and move cases forward. Because as I say, I make it very clear to every member of staff I work with, not just the DSPs, but our students, our young people are our priority. We are there to deliver an education, but we are there to keep them safe and meet their needs pastorally. So it's around having those channels of communication where that can be done effectively, but taking time, because I know no school day is different. Every school day, you know, next thing you know, it's 3:10. So the days are incredibly busy, but it's making sure that you prioritise that time and place emphasis and importance on that time, because it's so important for good practice that you have that opportunity to collectively review and share situations.
So in that practice of sharing, that fact of nobody owns a case per se, there's that, you know, you've got this case management process. Can you see that working in small environments, in small schools? What obviously some people that are asking questions are from different size of settings, and obviously you've got an organisation of size. How would that differ in a smaller organisation?
I think ultimately, fundamentally, you're not really talking that the much is going to change. It's just the management of what that looks like. So yes, you obviously have to scale things up when there's more students, there's more staff involved, but the fundamentals should remain the same, whether there's 20 children on roll, whether there's 200 on roll. It's around that understanding of the importance of that collective working, making time to ensure that you have those opportunities to meet as a DSP or DSLs or as a pastoral team. So it's just about embedding that practice into the culture of the school. So
and making time for it. And making
time. So that you have that opportunity to share, you have that opportunity to sit and listen, which is so important, and share ideas and experiences that ultimately will help in meeting the needs of that young person, which is what I say is always at the core, both pastorally and educationally. So I don't think it's about the size. I think it's about the processes that are put in place to ensure that those needs are met.
Yeah, I would agree with you entirely on that, and it is, and you've said a lot about that core purpose and the fact that it's, whether you describe it as passion or anything else, it's within us and within the values that we hold and deliver within a school.
It's recognising that, it's just recognising the need and the importance of safeguarding. Yes. If that importance is not recognised, you're not going to get the practice that equals what needs to happen. So it's so important that is it's a priority within any school. It's the duty of care of any school to safeguard that young person. And it's about allowing time, processes to be fully embedded into the culture of that school. And as I say, size really depends on, obviously, you know, how many you're managing, but actually the core values shouldn't change.
No, and we agree with you, applaud you entirely. Can we just move on to another question? And thank you for your clarity. So you referred to a safe place or a safe space system. A place to be, I think I heard you say.
Yes, so
just talk a little bit more about some of the systems that you use. So we've got CPOMs as the kind of recording mechanism, but what about some of the more practical systems that are used, that you're using or have used?
So as I touched on, you know, our school is, you know, we have a head of year, and attached to that head of year we have a student manager who isn't on timetable, who is a pastoral support. They're always available. They have their own offices. At the moment, obviously, again, with the constraints and, you know, adhering to all the socially distancing and the rules and regulations currently in schools, there are opportunities to meet with a member of staff. So we've also got Place to Be, which is, we have them 3 days a week that meet with our key stage 3 and 4. So ultimately, there's a space where young people can go and have those conversations if they're worried, they don't feel safe. We've also got a behaviour team, and we've got a huge inclusion team that involves lots of learning support assistants. So throughout the school, there are almost threads of opportunities in someone's daily life and routine where there is somewhere to go to throughout that day that they can access support. And that is so important for that young person to be able to feel that they're not interrupting a teacher, or they have that opportunity, time and space. And what I always say is, when I get asked this question quite a lot, that if a young person does start to open up to a teacher, you know, should they stop and try and get someone from the DSP or the DSL team to try and support with that incident? I always say, you know, if that young person, what you need to recognise as a professional, if that young person has chosen to share and make a disclosure to you, there's an element of trust that they've built in their own mindset to be able to do that with you. So it's about taking that time, listening, and then following procedure, which is obviously reporting, recording, and responding. So, you know, it's just about that all being quite, you know, streamlined.
And that's I mean, it's a really important point, isn't it? I mean, if a child has chosen you to talk to, they've done that for a reason, because they feel that they've got that synergy with you, or at least they've got an understanding ear that they will talk to. So it's not to cut them off and say...
the child may not have ever spoken, but what that teacher may not recognise is that person's there every morning. They're a consistent person in their life. So there doesn't have to be particularly vocal for you in your own mind as a professional to think that you've got a great relationship, but that child may have a very different view. So it's just having that broader understanding of why that young person may have chosen to have that communication with you. And even though you might think, well, he's never spoken to me before, it's not just about the verbal interaction a teacher can offer to make something a safe place. It's that consistency. And I think that is core, as I touched on earlier, to practice, is consistency. So absolutely. And okay, so we're at 3:40. One or two people have had to go on to other meetings, and they have said thank you so much for what you've done, shared with us, Debbie. It's been really powerful stuff and very significant. I've got a couple of other questions. If you have got of those that are still with us,
We do about another 5 minutes, but if you've got any other questions, please just drop them in the chat and Nikki will make sure that we can see them. My question, just picking up on that consistency issue, Debbie, when you've got a turnover of staff, and particularly staff that come from other schools with different value bases and come from different systems, what does it look like for you when new staff come in? You've talked about an induction, but what kind of things are you telling them? What kind of things are you doing with them that gets them quickly involved in the safeguarding and lead positions that you've set out within the school?
So we obviously capture all new staff almost immediately upon their start. They have obviously their mandatory level 1 safeguarding that all professionals have to undertake. But that's obviously for example, in Hertfordshire, that's a Hearts mandatory. But I do an induction with them, which talks about our systems, making sure that they know where I'm based in the school, where the DSPs, the DSLs are, and understanding the recording processes that we do record on CPOMs. They have their login, explain to them the systems of what this will look like, and make it very, very clear that the moment they become, they start practicing within the school, they have a duty of care and a responsibility. And that is, I can't place any more emphasis on that, which is what it comes back to when I talk about how we do this and the principles of making sure every staff member, it is not good enough for a staff member to go, I don't know who the DSP is. They have a responsibility to make sure that they're knowledgeable, but it's also a responsibility of the safeguarding team to make sure that that is out there and that every staff member knows who to access, how to access, and where to access.
Absolutely. Okay, so are there any other questions before we come to a conclusion? You've got the opportunity to ask of Debbie now. Just give you a moment.
I've copied
you can either come
so far out of the chat, but if people want to come off, take their microphones off mute, there obviously could ask that way as well.
Yes, yep.
Lots of people saying how much they've appreciated the input.
Great, thank you. If there aren't any questions, Debbie, by way of conclusion, if there was something that you wanted to leave people with, I can walk back to my organisation now. If there was one thing I was going to do, and one thing you would advise that people do, what would that be? And anything else that you want to conclude with?
I think ultimately it just brings me back down to why and principles, really. It's around keeping that child always in the centre, both educationally and pastorally, taking time to listen to that young person and respond to their needs. But consistency across the entire school, and that safeguarding isn't down to one person, it's a collective response and it's everyone's responsibility. And I think having those channels of communication across the school and the DSP teams to ensure that that support is in place for staff and for young people, I can't place enough emphasis on it.
No. I know from conversations that is at the core of what you do. Can I just say a big thank you to Debbie for sharing with us this afternoon. It's been really informative, and the video will be out on our YouTube channel fairly soon. So anybody who wants to drop back in and just pick up on some of the things that Debbie has talked about. There's some contact details on the screen here. If you want to, we won't give Debbie's direct contact details because she's an employee of an organisation, but if you do want to ask any questions or get any further advice from Debbie, then contact us at info@cj-learning.com and we'll make sure that details are passed through. In terms of the Smart Curriculum Academy leadership webinars, we've got 2 more coming up in the next month or so. Dave Evans from Engage Education, the Director of Education, on how to get the most effect out of your agency teachers and some of the funding opportunities that are available. David went through with me the other day some of the opportunities that are now here with some funding for apprentice staff coming through the agencies, which is phenomenal for schools if you engage with it. And then Mike Simmons in early October will be going through excellence and innovation in governance, another big issue for schools. And you can see on the screen some of the other things that are coming up. Can I just say again, thank you to Debbie for the first online presentation that she's done, and very effective and well done. So Debbie, thank you very much for this afternoon. It's been really, really good to see you. And I think from what I can see, everyone is saying thank you very much. A really appreciated session. Well done. Really, really great session. Thank you.